You've just finished a course of Doxycycline, you're out with friends, and everyone's ordering a drink. You almost order a glass of wine, but then you remember, antibiotics and alcohol don't mix. Even though you're feeling better, you don't want to mess up your recovery. So how long should you really wait after taking Doxycycline before having a drink? Let's dive into how this antibiotic works and why taking a short break from alcohol is a smart move for a safer, more mindful approach to your health. Doxycycline is a powerful antibiotic used to treat a wide range of bacterial infections all over the body. It belongs to a class of drugs called tetracyclines. It works by stopping bacteria from producing the proteins they need to survive, either killing them or preventing their growth. Because of its anti-inflammatory properties, it's often prescribed for skin issues, chest infections, dental problems, and even some sexually transmitted infections. You might see it under brand names like Vibromycin D or Periostat. The dosage really depends on why you're taking it, but it's usually between 100 and 200 milligrams per day. Lower doses like those for skin and gum infections don't typically cause major issues. But common side effects of a 100 milligram dose can include things like diarrhea, vomiting, a rash, or irritation of the esophagus. Some people even experience a loss of taste or a ringing in their ears. More serious side effects, though rare, need immediate medical attention. These include severe headaches, unusual bruising or bleeding, severe skin reactions, dizziness, or a fast heart rate. If you experience any of those, you should call your doctor right away. Before we get into the specifics of Doxycycline, let's quickly cover why mixing alcohol and antibiotics is generally a bad idea. You've probably heard this before, but it's true. Drinking while on any antibiotic isn't recommended. Some antibiotics like metronidazole have direct, nasty interactions with alcohol that can cause a racing heart, vomiting, and severe headaches. But even for antibiotics that don't have these direct interactions, like Doxycycline, alcohol can still cause problems. Alcohol weakens our immune system, which is the very system we're trying to support to fight off the infection. It puts stress on our body and distracts it from the critical job of healing. So, if we want to give our body the best chance to recover quickly and avoid negative reactions, it's always best to steer clear of alcohol while on antibiotics. Now, let's look specifically at Doxycycline and alcohol. Research on the direct impact of alcohol on Doxycycline is somewhat limited, but we know a few key things. First, alcohol can affect how medications are absorbed in your body. This means drinking could make your Doxycycline less effective. Think about it. You went through the whole course of medication, and you want it to work, right? Second, alcohol is a toxin that your body has to process, and it can actually kill off the good bacteria in your gut that help maintain a healthy immune system. This indirectly compromises the medication's effectiveness and can slow down your recovery. While there aren't typically dangerous, direct reactions between Doxycycline and alcohol, many of their side effects overlap. This means that if you combine them, you could make those side effects much worse. Because of all these potential issues, drug manufacturers actually recommend that doctors consider an alternative medication if a patient isn't willing to stop drinking. So, the big question remains, once you've taken that last pill, how long should you wait? Doxycycline has what's called a half-life of about 16 to 22 hours. This is the time it takes for half of the drug to be eliminated from your system. But to be safe, experts say it takes about 5 half-lives for a drug to be completely cleared. If you do the math, that means you should wait about 5 days after stopping Doxycycline before you have any alcohol. If you drink before that 5-day period is over, it probably won't cause any immediate life-threatening danger. But it can still indirectly impact your healing and open you up to potential risks. What if you accidentally had one drink? Should you panic? Probably not, but it's important to understand what too much means in this context. When you're taking Doxycycline, any amount of alcohol is not recommended. We all react differently to substances, so it's impossible to define a safe amount for everyone. In fact, according to the World Health Organization, no amount of alcohol is considered truly safe for your health with or without medication. Even after you stop taking doxycycline, the drug is still lingering in your system for those 5 days, creating the potential for these indirect interactions. Let's break down the negative effects of mixing doxycycline and alcohol even without a direct interaction. First, as we mentioned, it can decrease the effectiveness of the medication because alcohol can mess with absorption. That's a waste of your time and effort. Second, both alcohol and doxycycline can cause stomach issues. Combining them significantly increases your risk of gastrointestinal discomfort. Third, and this is a big one, is the potential for liver damage. Your liver is responsible for breaking down toxins, including alcohol and the byproducts of doxycycline. If you drink while the medication is in your system, you can overload your liver, increasing the risk of damage. Fourth, there are the effects on your central nervous system. Alcohol is a depressant, which can cause dizziness, drowsiness, and vision problems. Many of doxycycline's side effects are similar, so combining them can amplify these symptoms, making you feel much worse. And finally, dehydration. Doxycycline can cause diarrhea, and alcohol is a diuretic, meaning it makes you urinate more. Together, they can lead to significant dehydration. Severe dehydration can lead to higher concentrations of waste products in your urine, which can form crystals and potentially harm your kidneys. As you can see, even without a direct explosive reaction, mixing the two can still lead to double the trouble. So how can you navigate this safely? The simplest answer is to avoid drinking while you're taking doxycycline and for the full 5-day elimination period afterward. If you're looking for an alternative, try a non-alcoholic beer or a creative mocktail. A little patience goes a long way in making sure you don't jeopardize your recovery right at the finish line. It's also a good idea to keep track of any side effects you experience from the medication itself. This can help you and your doctor know if any adjustments are needed. Always talk to your doctor for personalized advice. They know your health history and can help you understand any other potential risks. If you find it difficult to stop drinking, even for a short period, it might be a good time to seek support. You can talk to friends and family, try apps designed to help you reduce your alcohol intake, or seek professional programs to learn science-based strategies for cutting back. Finally, focus on strengthening your immune system. Eating a balanced diet, getting regular exercise, and making sure you get enough sleep will help your body fight off infections and recover faster. These mindful practices can help not just with doxycycline, but with developing a healthier relationship with alcohol in general. To sum it all up, understanding the interplay between medications like doxycycline and alcohol is a key part of taking care of your health. While there are no severe direct interactions, the combination can still cause a lot of unnecessary risks and side effects. To be safe, wait for that 5-day window to pass after your last dose. Patience and timing are your best allies in ensuring a full and speedy recovery. Thanks for watching. If you found this video helpful, please give it a thumbs up and subscribe for more health and wellness tips. Stay safe and take care. This video is for educational purposes only and is not medical advice. If you have concerns about alcohol use or health, please consult a qualified healthcare professional or seek local support services.